The video in this week will review the ethics and ethical quandaries in community health nursing. As a practicing nurse, you are aware of the Code of Ethics for Nursing Practice, which include the ethical principle that the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Ethics is required in any healthcare setting, and community health nurses must also use ethical decision-making when caring for communities and populations. You should continue to use the same student learning outcomes as before, in which you identify the ANA standards of nursing practice when delivering nursing care in relation to ethical care, and to consider how these factors influence the provision of ethical care in the community. Ethics is a philosophy that has an underlying assumption of what it is and how to be good. Ethics considers people as inherently good. An ethical person understands what he or she should do in relation to being good, but in contrast to being bad, there are no regulated punishments if ethical principles are violated. In other words, even though someone may be reprimanded for a violation of ethical principles, there are no laws that punish unethical behavior. The reason for understanding ethics principles is to provide a systematic, logical framework for analysis, discussion, and decision-making that helps ensure that decisions are grounded in the philosophy of good actions. There are two approaches to ethical decision-making. The first is a deontological approach. This is a rule-based approach in which decisions are made by applying a set of rules of good conduct. This ethical philosophy was based on the work of Immanuel Kant, and the basic premise of his approach is that no person should be treated as a means to an end. Goodness or badness is determined by the action, and the only behavior that can be considered ethical is the one that has goodwill behind it. Examples of deontological rules include personal moral codes and professional codes of ethics, such as the American Nurses Association Code of Ethics for Nurses that was mentioned earlier. The contrasting approach is teleology, or consequence-based decision-making. This approach is based on the philosophy of John Stuart Mills. In teleology, the decisions are made on the basis of the greatest good for the greatest number. Goodness or badness of the decision is determined by the results of the outcomes. In a community health setting, a teleological approach states that any behavior can be justified as ethical if it produces the greatest good for the greatest number of people. In the current U.S. healthcare situation, the Affordable Care Act is an example of a teleological approach to healthcare access. It has brought about sweeping enactments on all Americans in order to supposedly provide access to healthcare for everyone. While the debate surrounding this provision is ongoing, it is nonetheless an example of a teleological approach that seeks to provide the greatest good in the form of access to healthcare to the greatest number of people, the population of the United States. The application of ethics to healthcare decision-making usually involves a combination of these two approaches. In the process of ethical decision-making, the available options are evaluated first to determine what option would be of greatest benefit to most of the parties involved, and then to ensure that the rights of all involved parties are respected. As a professional nurse, your overall role has 3 tiers of responsibility. In the community, the role of the community health nurse is to partner with the community and ensure a balanced participation between providers and recipients of health care. As patients in the hospital or as citizens in the community, individuals can be thought of as the consumers of health care. In order to recognize them with the most ethically based health care, we must recognize that not all individuals will be able to afford or want preventative care, nor will everyone understand what measures need to be taken to prevent ill health. As a consumer of health care ourselves, nurses must also be aware of what is available in the healthcare environment and how we as consumers are affected by the changes in healthcare. Advocacy understanding involves understanding the worldview, life circumstances, and priorities of those requesting or receiving care, and exploring any possible options with them in light of their preferences. This involves the community health nurse placing themselves in the situations and circumstances of the individuals for whom they are caring for, in the community or in the hospital, and an attempt to empathize with their prospective guides the best approach for providing health care. Another role is that of catalyst. In this model, the community is seen to contain all the necessary qualities and resources for change, and the role of the healthcare professional is to provide the spark that will initiate change, as desired by the community and on its own terms. In this approach, the community health nurse works with the community, providing information and resources to empower the community in resolving its own health problems, thus providing the community with the control and permanence needed for sustained change. The 7 principles that are essential in healthcare are presented here. These principles guide ethical decision making. Autonomy is the right of individuals to self-determination. In healthcare, this means that the decisions should be made by those most affected, whether they are individuals, families, groups, or communities. As implied earlier, any community program that is developed will endure only as long as those professionals remain active in the community, unless the community makes an autonomous investment to endorse and adopt the ideas behind the program. The second ethical principle is respect for people, and this recognizes that every person and community has intrinsic value. When this principle is applied to community health, it directs healthcare professionals to evaluate the effect of proposed initiatives in light of their implications for all who may be affected. In other words, if a community health program is introduced, will it take into consideration the values, beliefs, culture, and norms of all members of the community? The third principle is beneficence, which is the desire to act in the best interest of others. Most people who enter the helping professions, such as nursing, do so because of an altruistic desire to help others. But because of this desire to help others, healthcare professionals are often faced with conflicts between these two principles. An example of this conflict is the issue of turning off an AICD, or automated implanted cardioverter defibrillator, at the end of life, or when an individual decides to forego resuscitative measures. As healthcare professionals, doctors and nurses know that the AICD can sustain an individual's life, so turning it off could be considered patient-assisted suicide. Another ethical principle is non-malfeasance, which is the avoidance of harm. As a nurse, you know that sometimes healthcare decisions may offer no really good choices that bring about positive results, but at least there may be a choice that does not cause outright harm. When proposals are considered for community health initiatives, it is important to evaluate not only what positive good may come from the activity, but also what harm might result. In an example of the application of this principle, in deciding where to place a community landfill, moving it from one area to another may bring beneficence or good to some members of the community while causing harm to others. Justice has 2 aspects: distributive justice and retributive justice. In distributive justice, the fair distribution of rights and resources is considered. These considerations are centered on the allocation of scarce resources in ways that are the greatest benefit to the most people. In this context, community healthcare providers and advocates argue for increased governmental support for preventative health programs that lead to better quality of life, or beneficence, for the greatest number of people in the community, which supports respect for people. Retributive justice is concerned with rewards and punishment. When allocating resources, such as money and programs, to a community, politics are usually involved. Resources are commonly rewarded to those who have provided support to those in control of the resources. Grants and projects often come to communities that have demonstrated a strong voting record for those in power. Veracity is the commitment to tell the truth. In community health nursing, veracity centers on honesty about who you are and what you bring to the community. Community health nurses may find themselves entering communities that have become accustomed to outsiders bringing in programs, goods, or services. These things may or may not meet the expectations of the community, depending on what has been promised or led to believe would happen. It is important that the community health nurses are clear from the beginning that, in the spirit of community as partner, the only true gift is the gift of the nurse, the gift of self, offering advocacy and work as a catalyst to improve the health of the community. The last principle is fidelity, or faithfulness. When working in the community health nurse must be careful to make promises and then work to keep them. Much of the efforts in community health nursing involve building relationships to advocate for community health problems and understanding how the principles of retributive justice and political involvement impact a community. Ethical quandaries or dilemmas commonly occur in the realm of community nursing. Consider that in clinical practice, healthcare professionals, including nurses, control the individual patient's environment. Patients are on a set schedule according to the needs and requirements that are dictated by the patient's condition. Meals are served at a specific time, tests are conducted according to schedules, and so on. Ethical dilemmas usually take the form of interpersonal conflicts between the healthcare professionals and the patient, such as when a patient wants to leave against medical advice. In the community setting, ethical quandaries can involve a much greater scale of individuals. Quandaries regarding autonomy and the public good are prominently featured in many of the Healthy People 2020 National Health Goals. For example, one health indicator used to measure progress toward reaching these goals include measures of obesity. This health indicator is an illustration of autonomy versus the public good because individuals have the right to eat what and where they like. They have the right to choose their food from a variety of resources. But the economic strain and incidence and prevalence of diseases related to obesity have demonstrated that this right to eat, to the point of obesity, has distressed the public good. Consider the number of obese patients you have cared for in the hospital setting and the impact this has had on their diseases and health treatments. According to the CDC, the medical costs for people who are obese are at least $1,400 higher than those of people with normal weight. In the United States, we spend about $190 billion each year on obesity and its related health problems. You are probably seeing the effects of this obesity epidemic as you care for these individuals in the hospital. Ethical dilemmas regarding respect for people, autonomy, justice, and beneficence occur as community health professionals are challenged to respect the rights of individuals or communities to choose other alternatives in the pursuit of improved health. When the economy takes a downturn, severe cuts in programs that focus on the mentally ill and substance abuse are usually the first to lose funding, which implies that these community members have less value than others in the community. Another example of this dilemma occurs when choices and goods delivered to impoverished areas are not up to expected standards, such as when donations of clothing and blankets for homeless individuals turn out to be discarded, unusable items. A frequent source of conflict encountered in the community is the desire to help those whose values are at odds with those of the person desiring to help them to improve their health status. This is a conflict between autonomy and beneficence. In the clinical setting, individuals may be counseled to quit smoking to improve their health or to work with a diabetic educator to learn how to control their disease. But once these individuals are discharged into the community, this education appears to vanish, as individuals who do not value this education and do not prioritize this aspect of their health will not follow the prescribed diet or work to resist tobacco. An example given in the textbook is one in which a community health worker began a new outreach program to identify individuals in the community at risk for human immunodeficiency virus. These community healthcare professionals found that they needed first to provide information and access to basic needs like housing and food. The community members were more concerned about immediate risks of these problems than long-term possibilities of contracting AIDS. Quandaries regarding respect for people, autonomy, justice, and beneficence can be seen in the form of the Affordable Care Act. We are living in a time when access to health care has become a national concern. The Affordable Care Act was designed to give access to each individual in the United States, but there are many concerns and issues after this implementation. Access to care does not equal care, and individuals still may not be receiving the health care they need. Access to care issues also highlight the health disparities between rural and urban patients and families. As part of the planning for the health care reform, researchers tracked and compared health outcomes for urban and rural elderly patients. The results showed that more rural patients are sick, more are receiving care in hospitals and nursing homes rather than at home, and fewer are surviving similar health conditions. The last ethical dilemma presented in the textbook involves conflicts between autonomy, beneficence, and non-malfeasance. A case study involving the people of Tarahumara is discussed, which provides an excellent example of how health professionals may believe they are acting altruistically with the best of intentions, but inadvertently may set up situations where the ethics of the beliefs and actions cannot always be known ahead of time. There are many ethical questions in this case study, and this demonstrates how our own modern worldview may not have all the answers. This is one of the problems with ethical decision making. Although we do our best, sometimes we still don't get it right because we can't know everything about the situation. Ethical decision making in the community setting is a very complex process and requires much experience and insight into the multiple factors and variables before any action can be taken on behalf of the community. This video presented ethical concepts relating to community nursing and community health. The ANA recognizes and requires all professional practicing nurses to know and uphold the Code of Ethics for nurses in each practice setting, including the community. The ethics you uphold as you work with patients in the acute care setting should transfer to working with individuals and communities outside the hospital. The factors that influence community health must also be viewed from an ethical perspective, and understanding how these factors influence ethical decision making is an important aspect of community nursing. To work as a nurse in the community, you must really learn to recognize and understand the big picture.